Let me get out of the street. So, welcome to Medical Doctor Travel. This is a new style of filming since I'm here in the Netherlands. This will be my very first recording here. I'm on the quaint town of Delft. Hey, some light rain here. It's about 6 Celsius degrees, and I'm here at the Medisch and Pharmaceutische Museum of Delft. It's Medical and Pharmaceutical Museum. I'm here with Suzy. Is Suzy short for Suzanne or something like that?
Yes, my full name is Suzanne. Yeah.
You are one of the curators, one of the responsibles of the museum here.
Well, not really the creators. That's those people on the picture inside. There's a brother and a sister called Griffioen, which is Dutch for the Griffin, and therefore the museum is called the Griffin. And he was a physician, and she, his sister,
Let's
was a
get closer.
assistant in a pharmacy, and later on he became a hospital director. And in that time, in the 70s, 80s of the last century, many hospitals they were fused. So two smaller hospitals become one big hospital, but because there were too many beds actually. And so when hospitals fuse, they have some apparatus twice. They need only one.
Sure.
So they were going to throw away a lot. But Mr.
Let's get closer. Also because the rain is getting slightly heavier, so it's actually...
Mister, if you didn't like throwing things away, there they are.
So,
They have died both a few years ago in their 90s, and well, they have founded the museum, and they for I think about 20 years they run the museum, and without them it wouldn't be here. But now we are with a group of volunteers. And we take care of the museum and give tours and so on, because it's a private museum. We don't get any funds from the government, so we're all for private. The maintenance activities that have been going on, and so that's why the old pharmacy. It's a pity that's still closed, because it's all covered, and well, you may have a look, but that's not for a video.
oh, but still quite an original place.
Well, it's all placed in there. It was not a pharmacy originally, but we placed the chests and so on in it, so that it looks like an old pharmacy.
What was this building originally? Was it residential?
Well, that more beautiful building next to us, that was a brewery for beer and so on. And here that lived the keeper of the brewery. Well, not the owner, but the man who did the work and who should keep an eye on it. So he lived next door.
Residential.
And later on, well, there has been a dressmaker that has lived here, and well, it's rebuilt several times. And before it became a museum, it was a bureau for a general health bureau, where the mothers with their young children, they came here to, because young children, well, from the government we have controls if there is taken good care of the children, if they grow enough, if they can see and hear and so on. And that's that kind of building was here. The mothers came here with their babies, and they had the investment so that they could be examined if everything was all right. So it had already to do with healthcare before it became a museum. And well, because the founder of the museum, he had a very large network, knew many people in the medical profession. That's how the museum got this location. But later on, the collection grows and grows because we still, I get the mails, I'm the mail contact person, and there are still many people who find the heritage of their grandfather and who was a physician, and they ask us, can you use the instruments of our grandfather? But we don't always say yes because it's only with this building and it's already rather full. So we have to think before we accept other people's heritage. But it's the way that we to get all interesting objects in the collection.
Yes, even in Brazil, this is very familiar to me because I've seen medical doctors that collect old pieces.
Yeah,
it's very common for families to have like someone is a medical doctor and their parents and their grandfathers, and they have, oh, this is the original piece my grandfather used. This happens a lot. I'm going to come slightly here because you can see it's following me. So if I come here, you can see.
The floor here is the pharmaceutical department, and over there we have all kinds of apparatus for diagnosis. Simple thermometers and apparatus to measure the blood pressure and the rate of the pulse with time glasses or otherwise, but also more sophisticated apparatus like for the ECG, electrocardiogram.
Yes, this is not something I was originally intended to discuss at this specific museum, but if I'm not mistaken, I think it was Eindhoven who developed the EKG. He is Dutch.
And he won a Nobel Prize in that's the Eindhoven with his apparatus. That would be too big for the museum. Here we have one from 1933 and another one from 1950. So these are the more compact examples.
And the original one is from 1902.
Yeah.
So this was already 30 years of development.
Yeah, he got the Nobel Prize in 1924.
Yes, I have a cardiologist, kind of friend of mine. It's an acquaintance, I know him, I've talked to him a few times, and he's at Harvard Brigham Women's Hospital, and he always likes to say, I did his EKG course, and he was always saying that EKG is an excellent exam because it's so readily available and diagnoses a lot. And one of the so to speak, the pros of EKG is how readily available it is. If you go to a very small local place of medical care that's not really a hospital, you don't have like a tomography or an MRI, but you always have an EKG.
Yeah, that's
and
right.
To some degree, I think this plays it a bit into context because we didn't always have EKGs. There's quite a long history before it could become something like relatively small and easy to operate.
The first sphygmomanometers for the blood pressure with mercury in it from 1896. well, the stethoscopes, of course. Oh well, this apparatus here you can register the pulse and the heart rate at the same time. I must admit I'm a pharmacist myself, so I'm not quite so familiar with the. Well, of course, I've learned about physiology, but I'm not so familiar with that kind of apparatus. Of course, for blood pressure I know, and there are several types of it. But of course, with mercury, that's not used anymore. Although in earlier days, thermometers with mercury were also quite common.
You know, at the hospital I studied, the sphygmomanometers are very familiar because their design hasn't changed that much. You have the
the principle is,
so it's somewhat similar. But at the hospital I studied at Gefreguini University Hospital in Brazil, we still had some sphygmomanometers with mercury. So it wasn't very common, but we still had like one or two still in use, and you could go there and get them. And it always bewildered me the amount of mercury that was in that thing, because usually we have contact with thermometers when we talk about mercury.
Thermometers, and when they break, then you have the problem. With the mercury, although I've worked in a laboratory during my education and also afterwards, because I've taught analytical chemistry to pharmacy students later on, and then we had the special apparatus to clean up and to find the small balls of mercury. Well, here we have also the apparatus that was used in the 17th, 18th century. In that times, the physicians worked, and they had the theory of Hippocrates of the four humors, so blood and mucus and
Bile and phlegm.
That's right. And when you had too much of one of them, then you were ill. And it seems that most of the time they thought you had too much blood. So bloodletting was a quite common method for all kinds of diseases. And you had very small, very sharp knives. For the vein, and then that kind of ball to catch the blood.
So they like cut on
the. We have a picture. Could be that we have a picture upstairs of bloodletting. No, that's. Watching the urine, which was also a very common method, my diagnosis. Where you had a special flask, and where they put the urine in, and then the color of the urine could tell something about the disease. And well, there were not only physicians, but also what we call quacks, people who pretended to be physician, and they used that kind of circle. Well, that was very simple. You watch the color of the urine, and then there on the outside was the disease. But it's not. There also are very dark colors, and well, maybe. People did have that dark urine because they probably drank less because there was not always good water. But it could also be that it was a bit of a fantasy.
Yes, it's really interesting. I think we went through two very interesting propositions, the bloodletting and the urine, because they both have something common. They both have some basis in reality. I'll start with the bloodletting. You know what I think is wild just about bloodletting? The fact we still do it. Because it really sounds a bit like medieval.
Yeah, that's right.
You're going
Yeah, you do something, yeah.
someone to let the person bleed. And yet, for example, even nowadays, you see, for example, one of the major treatments for hemochromatosis. Hemochromatosis, I'm not sure whether you are very aware of the disease, but it's a disease when you cannot control the amount of iron you absorb.
Yeah, that's right, yeah.
So you get iron overload on your body,
yeah.
and that can damage some organs, such as, for example, the liver. And you have other drugs, but the basis of treatment for hemochromatosis is bloodletting.
Yeah.
And of course, you don't just cut it and let it bleed, you just put a syringe and you take, like if you are donating blood. So you take, like, for example, 500 milliliters from the person, and then you just discard it. So it's more like hygienic than before. But it really sounds medieval, and to this day it's weird to recommend like bloodletting to a patient.
Yeah, but still, I can imagine. But and we all, of course, this with a knife was not always easy to find the vein. So there were different methods. This is what you probably also know is a method of cupping. And that's still done
Yes.
These days. And by sports men, because the cupping, well, that's, you can have the dry cupping, then you just put the cups on the skin, and you get a kind of, because the vacuum under the cup, the old method was you had such a glass cup, and you warmed it just on the candle, and then put it on the skin, and then you get well, not really vacuum, but a kind of vacuum, and therefore you get a kind of blister because of that vacuum, and well, so the bloodstream is probably better. That's what sportsmen like, but it then you call dry cupping, then you stop there, but with what we call wet cupping, then you take this apparatus that is, it's the English word is scarificator, but there are very small knives and it has a spring, so then when you release the spring, then these small knives come out, and when these blister, then of course it's a very simple way to get the blood out. And there is a third way.
And just before we go to that way, regarding the urine, there are some things, for example, when you have diabetes mellitus, you have glycose in the urine. So in theory, the urine should taste sweet. Absolutely no one will do it nowadays, but there are some theories that people sometimes diagnose diabetes by actually tasting the urine.
That's right.
And there are some very specific conditions when you can diagnose it, a disease from looking at it, apart from some like obvious bleeding, if someone is bleeding the bladder, of course it will come bloody. But apart from that, for example, you have like some kinds of porphyria, where exposing the urine to the sun can change the color. So it's interesting because there is some degree of truth. You can see that they were onto something.
That's quite true. But well, I think you always, with all kinds of methods, you have had people who thought, well, this is all of it and nothing else, and then they kind of exaggerate it. But it's, of course, it's still in some ways useful. But it's not the only thing. But we have here also the older laboratory apparatus. But these are more for hemometers, just for the how much hemoglobin in the blood is. That's a very simple one, which is you compare with different colored tubes, and there are more sophisticated ones where you can then well, it probably also it gives a line on that one.
There are some old syringes here and some
Yeah.
old surgical instruments.
Yeah, that's in earlier days. There only were the glass and metal syringes, and we also have the apparatus you see here. That it was we called it paratus because it's paratus means ready, and then the syringe went in, and you see the small holes in the circle around the inner
Sure,
vessel.
sure.
There were the needles put in, and that was all in the alcohol, and
An urgent
the
way
lid on
of
top. And then
aseptic.
they had idea that they thought that it would be sterile and stay sterile. Yeah, alas, alcohol does kill quite a lot of bacteria, but not all of them. So especially when the physician went with this apparatus from one patient to another, it was not good hygiene. But when I started as a pharmacist, which is more than 50 years ago, then diabetes patients, they had such a thing for just for themselves. So for one patient, it could be used because it only his own bacteria were attaching the needle to the syringe. You had the record and you had the Luer lock. Nowadays it's most times Luer lock. That's on the right one, and the simple ones on the left are the record syringes.
Yes, most places abandon the metal and glass in favor of plastic, which is easily discardable.
Yeah.
But yet, I hear that, for example, in some places in the United States nowadays they discard even the metal. Like they use a scissor for cutting tissue, for example, in a surgery, and they discard it instead of sterilizing it. Maybe we are all walking in that way. I think it's a bit overkill in that much.
Well, if we think that we should use less plastics because of the plastic soup in the ocean, yeah, maybe sterilizing the metal ones would be the new idea. But yeah, this is more from this all kind of sutures of wounds.
Oh, sure.
And very old ones that the plants were used for it, and even ants were. So then the ants, they kept the ants above the wound, and when the mouthpieces of the ants gripped with their
The sides of the wound.
the side of the wounds, then they put it together, and then of course it was then they cut the head of the ant off. So
Oh, okay. So it
the
makes
ant didn't survive, but
no, it makes a bit more sense now, because I was exactly thinking, okay, but how is it going to stay closed? Okay, it makes some
and
sense.
that door quite well. It says the grip of death. The ant died, and in the kind of spasm held the edges together.
Yes, some here are familiar to me. The traditional cat cut, for example, one of the most often used in surgery. Here we have a stapler, very used, for example, in lung surgery. Yeah, but these pieces here.
Yeah, these are for the physiotherapy. Here for massage, and when electricity was rather new, about 100 years ago. Then they thought you could heal all kinds of diseases with electricity, and then nerve stimulation, I think, is still used against pain. Then you had all kinds of accessoires you could put in your ear, or even a comb, so that it was used for about everything. And then some of we tried it some, and then you feel kind of tickling, prickling on the skin, and well, that were kind of magic. And we now one here, but we have about 10 of these, and even still get some offered. So very many physicians, probably, you should have an apparatus like that about 100 years ago, otherwise he wasn't a good physician, and then later on it wasn't used anymore. Yeah, this is the disinfection and vaccination.
There is an important contribution from a Dutch scientist to microbiology. I think Leeuw Vatten, sometimes known as father of microbiology, that worked with lenses, was the first to see a lot of cells of microorganisms.
You don't mean that was actually also microbiology, but a famous citizen of Delft in the 17th century was Antony van Leeuwenhoek.
Yes, Leeuwenhoek. Yes,
Antony van Leeuwenhoek. Well, I'll show you that upstairs with his microscope. It was more like a magnifying glass, but he, with his apparatus, a very small apparatus, he reached a magnification of 250 times, and whereas in that time you couldn't get further than 40 times. So he was very good in making lens making, because the apparatus is rather simple, but it all depends on the quality of the lens. And this Van Leeuwenhoek was very good at making these lenses. But we only have a replica here in the museum, the Boerhaven Museum in Leiden. That's a real one.
I'll be there tomorrow.
They'll probably show you, but we could go upstairs first, because here is more like nursing apparatus and maternity care. So the first incubators, there was hot water bottles.
So Jesus meant essentially just for warming.
And then it's more sophisticated than they would think, because it does have a thermometer, and also there should be a sponge, a wet sponge in it, so that the air was
humidified.
And so they had the thermometer. So you could, more or 5 or 4 or 3 hot water bottles, so you could control the temperature. Here they had it, it's the thermometer there. It even had a kind of chimney, so that the hot air could get out easier. Yeah, that one is a model of what, that is a Frenchman, I think. Yeah, but this is about 1870. Yeah, that's that one. But the air can go, the hot air can go out. This one also probably has that you need also the sponge.
Yes, this room reminds me of pediatrics.
Yeah,
reminds me of pediatrics rotation.
Yeah, and also in for maternity care, that's you have here the silver scissors supposed to use to pick up wet nappies. But well, we in this time we doubt whether that was so useful, and we think it was more well like decoration. And there even is a story that in the Victorian times, the 19th century, well, you couldn't just tell that your wife was pregnant. That you couldn't talk about that, but then they put such scissors on the chimney, the mantelpiece of the chimney, and then everybody knew what was going on, but you couldn't talk about that. That's the story. I'm not quite sure if it's true, but these scissors don't seem very practical to really use for nappies. Yeah, that's also bedpans and irrigators. Now this is also funny that nowadays all the beds in the hospital have wheels. But that was not always like that. And before they all had wheels, you had this what we call the bed bicycle. Then you attached this apparatus to the bed on both sides. And well, when you I don't get it in position, but it was meant that when you put it down, that the bed came up, and so the wheels, the four wheels, two on each side, you could use to move the bed.
Kind of like a lift. You lift the bed a bit and then.
Yeah, it's still.
Yes, exactly.
And I'm back again, I suppose. Then. and we, well, she's. Her health is not good enough anymore. But we had well, she should be 85 or perhaps almost 90. And she used to be a nurse, and she had used these apparatus, and she said yes. And we only had one pair on the ward. So when a patient had to go to another department for an X-ray, for instance, then you couldn't move the other beds because you had to wait until this thing was. And for ladies and for gentlemen.
Still in use, pretty much the same nowadays. This is something that hasn't changed that much. Of course, nowadays we love indwelling urinary catheters, so whenever a patient stays more than a few days at the hospital in bed, they often get an indwelling catheter. But to those patients that do not have a catheter, these specific, I'm not sure how they are called in your language, but these specific kind of pots are still very much used this day.
Yeah, sure. Yeah, although for men it's never a problem, but for the ladies you see all different kinds of models. This is called flat iron, and well, I'm not very experienced myself, but they say that for ladies it's the ideal type hasn't. They haven't found yet, but for men it's very simple. Sometimes when we also get students who are becoming a nurse, and then I show them about this one and also these
clear
the porcelain ones, and pewter. This is pewter. The material is pewter.
Yes, it looks like iron. I'm not sure.
No, I think it is pewter, and they all are very heavy. So then sometimes I say, well, nowadays it's perhaps a very it's not so easy work for nurses, but in earlier days you had to be really strong to carry all this, and also to use that bed bicycle. Yeah, and all kinds of hot water bottles, of course. And this is also it's for to wind around legs and so on. And this same lady who had used the bed bicycle, she told that in the night service, then the materials were washed and they had to wind it, rewind, and especially in the night service. But it was not good when the nurses would just sit down. They had to do something.
But was this like for cleaning or for wound dressing?
Wound dressing, and also for open legs. You know that you could wind it round the leg to stimulate the bloodstream.
Okay.
So that's still, but then, well, one have elastic stockings are used nowadays, but these, perhaps ik heb tried to find the word for what. No, it's just, nee, not on there. Now we have a kind of a little help because all the terminology in English that's not so easy.
Oh, okay.
So that's here's the Dutch and then.
Do you get many English-speaking visitors here?
Not so many. Sometimes, well, Delft, of course, has many hotspots and. Old buildings and the museum, the Prinsenhof, and so when people happen to pass by, then they will get in. But the problem is that normally we are only open for groups, for tours for groups, and then one Sunday, the first Sunday of every month. Then in the afternoon, the museum opens for individual visitors. But well, of course, when the tourist is not on the first Sunday of the month, then he has bad luck. But we have a minimum of 5 persons. But for people from abroad, sometimes we also for a few less than that 2 or 3, then we can do that also.
Let me use this opportunity also to thank you for opening this exception, for opening the museum for me, especially today, and also to talk about the conditions. Then you said that usually on Sundays. On
Sunday afternoon, the first Sunday of the month. But then it's, there are people and you can ask questions, but we do not give a tour. So then it's, the price now is €6, whereas the tour is €7.50 per person. We do give tours in English also, although you see that it's not always easy because we don't know by head all the special medical terminology.
Yes, fortunately, most Dutch people speak English really well.
Yeah, but these special things, I'll look for you.
Was
bandages.
Bandages, okay, great. Was Röntgen also Dutch? I had heard of him, of course.
I thought actually that he was German, his family. There were also Dutch Röntgens because there is also a composer called Röntgen, Julius Röntgen, and he was Dutch. But as far as I know, was this Röntgen of the X-ray, he was German.
Yes, sometimes people travel a lot. Before coming to the Netherlands, I was reading a lot, of course, about Dutch history and Dutch people, so that I could have some background to talk about. And I saw, for example, that one of the most famous personalities here in the Netherlands, I'm walking a bit around you just to make sure the camera always centers correctly. But one of the most famous personalities here is Erasmus. Which gives the name to a lot of things around here.
Yeah, and in Rotterdam,
Erasmus Bridge.
especially in Rotterdam, although, well, I live not far from Gouda, and in Gouda he was born, although in Rotterdam they say no, he was not born there, but as far as there was a monastery there, and we think that he was born there and his childhood was in Gouda. But most of his life, of course, he was in Rotterdam when he was not abroad.
Exactly, and that was my point. He spent like a few years here in the Netherlands and spent time in England, spent time in the Holy Roman Empire.
He said, I'm a world citizen. That's well, yeah, he said it in Latin, so that civis mundi. Yeah, that's what he said.
Yes, so that's how the cheese name is pronounced, Gouda.
Gouda. Yeah, Gouda.
Ever people pronounce the Dutch names. Very few people speak Dutch, so people pronounce the Dutch names around the world in very varied ways, in very creative ways. I was trying to, for example, I'm from Brazil, and I die a bit inside every time someone says, I visited São Paulo. The correct pronunciation is São Paulo. So I try to learn how to pronounce some names of cities and some things. So like not Amsterdam, but Amsterdam.
Yeah,
I think
that's the right.
Rotterdam.
But I think Portugal. I've never been to Brazil, but I've been several times to Portugal, also Madeira, and I tried to learn a little Portuguese. I always like to speak a little of the language of the country where I am. But then, well, I tried, but the right pronunciation, het was dos, dat you see, that's very difficult.
Is Schiphol, is that how I pronounce it? The airport.
The airport, Schiphol. Yeah.
Schiphol.
Yeah, that's, most people say perhaps Schiphol, but it's yeah, that is soft.
Schiphol.
But shall we go upstairs?
Absolutely, absolutely.
Die Van Leeuwenhoek microscope, of course. Now I'll take my little help list with me. There is one more.
Absolutely, you guide me. Feel free to show whatever rooms and places. You know this museum far better than me. If there's someone who knows where we should go next, it's you.
Yeah, this is here more for the specializations. Dit is for nose, throat and ear specialization. But what I especially wanted to show you, here are all kinds of enema syringes. That's why they are so big. Well, it's a funny one is that one, the Swamem. So that's, well, of course, when somebody has to administer an enema, well, especially ladies, they don't like that so much. So therefore they thought, well, with this way you can do it yourself, but then you have to sit on that one, and then you kind of pump with the other one. Well, it looks not like a very comfortable.
Well, to be honest, to this very day, most, let's say, most procedures that go through the anus, such as a colonoscopy, are still dreaded by most patients, even with all our technology and even with sedation and drugs such as midazolam, for example. Still, most people don't like to undergo colonoscopies.
No. But this is a very special, and that was used when people were drowned and they got them out of the water, and then most times they were unconscious, and some maybe they were dead already, but to be sure that they were only unconscious and not dead, that enema was used. First, one is the long tube on it. It looks like a pipe, a pipe you can smoke. Well, that's what they did with that. Put tobacco in it and lit it and well, smoked the pipe. And then the other part of the device that goes on top of the pipe, and you put that end of the pipe into the rectum of the patient, like you see at the picture, and then you blow, because this tube is hollow, so you can blow from the upside, and it's so then you blow the smoke, the hot smoke, into the rectum. So that seems to be very uncomfortable.
Yes, I really wonder where they got this idea from. But
well,
what was the theory behind it all?
In those days it happened now and again that people were not dead, and they were apparently dead, and they were buried alive. So this was a way to be sure, and that they were, because if you were dead, well, there is no reaction, but if you're unconscious, there is a reaction.
Yes, it's kind of like that which you do on the sternum of the patient. When you have a patient that's, for example, unconscious, you first call for him or for her. Are you hearing me? Can you move something? If the patient doesn't do anything, you can try like to shake him or something. If the patient is still immovable, you apply some moderate pressure on his sternum with your fingers. This should generate some small pain, but without leading to any permanent damage. And if the patient still doesn't move, then that means he's kind of comatose.
Yeah, and it was even so that this apparatus was compulsory for physicians in the 19th century, and also at locks. Here in the Netherlands you have the enormous amount of water, the waterways. Here the canals, and also in the lowlands, the whole western part of the country, many of the what we call the polders, they are below sea level. So always there has to be pumped to keep it dry. So you have the waterways, sloten, as we say in Dutch. So there were many opportunities to get into the water, and nowadays children learn to swim, but in earlier days that was not so common. So this at locks and near bridges, the lockkeeper also had such an apparatus. That in the past century, in the 19th century,
kind of like we have.
It was compulsory.
Kind of like we have automatic defibrillators nowadays at airports. You go to an airport, there is somewhere on the wall an automatic defibrillator.
That's also that's one of our really.
This looks interesting.
That is what they call an anatomic atlas. it's quite a compilation of drawings of the human body, and well, we for all the parts, and then in
This is the original from
That is the
the
original.
1700s, and this is a printed copy, so
and
that people
it's
can look
also
at it.
on via our website. You can also view it because yeah, we have it here. Of course, it's rather fragile, and it in light and so on. That's not then it deteriorates. But you can view it via the website, and I think it's amazing how very accurate these drawings are. This is the liver, I think.
Yes, this
And kidneys, and also the inside.
If I may, I'm going to just leave it so that it stays.
Oh
good
yeah,
to the
this is of
camera.
course you
but-
get yeah.
Yes, here it's clearly the kidney. It's apparently removing that capsule, for example. Here we have the renal pelvis from
Yeah.
where the urine goes down. This one, for example. This is also kidneys here,
Yeah.
the bladder.
Yeah.
I think this is one of them is the aorta. I think these are the ureters. And so this must be the inferior vena cava. This is a abdominal cut. Mostly you can see the liver
Yeah.
upwards here, great vessels here, bladder. Because most of these cuts, yes, here we see a lot of omentum. This is a bowel, a segment of bowel, and omentum to
Yeah,
reach
right,
the
yeah, with
arteries and
the-
veins,
Yeah,
and everything goes through.
the bowel, well, they called flakes, we call it. Because
This is the gallbladder, I'm not sure.
Oh yeah.
This is a liver, undoubtedly. Was the anatomists who drew this very known? We can see here the clavicle and the ribs,
Yeah, this
the thoracic
this is
vertebrae.
this William Cowper. I think that was an Englishman, and that it was Cowper was an Englishman, and this print is from 1739. In Govert Bitlow, that was a Dutchman. He had also edited an anatomic atlas in 1685, and the Cowper had bought the pictures from the editor, because this Bitlow edition wasn't sold very well, and Cowper he made a new text explanation with the drawings, and he added some, and so this Cowper atlas that was sold better. But this one is given by in Delft, a physician's family from Delft, the family Wassink. That you can imagine that when from father to son, that it's a family that they have that, well, what you told in the family, and they are.
This is Latin, right? And the original one was written in Latin, like Fetus in uterus, jacem profituone naturale, Fetus profitura in utero, plurimum variate, praefert in si cartem partus. I think it's Latin.
Yeah, it's
Is it?
Latin. Yeah, it is. Yeah.
You know what I wonder? How did they copy the illustrations? Because for letters it's easier. You're just using like the Gutenberg press and it can copy. But how did they copy the illustrations back then?
It's here. It is copper. Copper. It says copper gravures. So it's probably they use a copper plate. You get the pattern in the copper plate, and then you can make prints of that. That's how it because it's called ja, gravures zeggen we.
Ironically enough, I understand gravure because although it's pronounced completely different, we have a very similar word in Portuguese, which means engravings. So
Engravings, yes,
yes,
yeah.
because it's a pure coincidence because Portuguese and Dutch have no similarity.
No, but Latin and Portuguese, yes.
But for whichever reason, the word's the same.
Yeah, I think that it's.
We pronounce it gravuras, but
it's
understandable.
Gravures zeggen wij zo. Copper, wacht even. Copper engraving, yeah. That's what Google Translate makes us. Ze zeggen koper, maar koper is ja cuir in French. My Portuguese is only very.
Je parle français, mais pas aussi comme en anglais. Donc, je peux parler en français, je peux faire des choses de jour à jour en français, mais pour faire des discussions médicales, je peux faire l'anglais. I'm not that good in translating names of metals or medical.
And I'm glad I can do something in English, but I have learned French at school and on holiday in France. I can manage, but here no, I wouldn't try that.
Well, ultimately, neither of us are at our native languages. Your native language is Dutch, my native language is Portuguese, so we're both using English as a lingua franca.
Yeah, that's but at that days, Latin was the international language, especially for scientists. And I think that Erasmus also corresponded in Latin, although he was also eager that the people should have the Bible, for instance, in their own language. Now I see here the picture of the bloodletting, because we have here more. I told you, like here you can see how it's very, it's a breathing thing. That here's also the tourniquet, what they use, what they still use, and here is also.
Okay, I see the image of the bloodletting.
Yeah, and here you see also the cupping for the simplest way.
And for the blood cupping, you talked about that.
But that is what.
Yes, I've never done it, but I practice CrossFit, and many of my friends at CrossFit do it regularly.
This is also. Put the lights, because here I have the wax magnets, and.
Oh, interesting.
They shouldn't be too much in the dark. But this is what we call the room of Reinier de Graaf. Reinier de Graaf also lived in Delft at the same time as Anthony van Leeuwenhoek. And maybe you know the Graafse follicle in the.
Yes.
That's Reinier de Graaf.
I spent my entire life pronouncing it Graaf. Follicle. But I know
well, that's,
exactly what
and he lived in Delft, that's why we honor him also. And it was he, because he knew Latin, who introduced Anthony van Leeuwenhoek, who was more a merchant in drapery, in tissues, and therefore he used his microscope to count the threads. And because he couldn't see that, so therefore he started making microscopes. But he didn't know Latin, and but he had this very sophisticated microscope. So the Graaf introduced him to the Royal Academic Society in London. And because the Graaf thought they should know about this microscope. So they were acquainted with each other, and the Graaf He did many examinations on dead bodies, and he found a lot, discovered a lot of the female genitalia.
The female anatomy microscopy,
The reproduction.
yes, the microscopy of the female menstrual cycle.
Organs, yes. And he also discovered to make the first syringe. And of course he didn't use that to give injections to patients, but he used that to preserve dead bodies. Then he, in the veins, he injected kind of wax solutions so that it stayed open in the vein and he could better see it. He died very young, at the age of 33, and they think that because he did so much work on dead bodies, well, that he probably got a disease. After his work. Well, this is a rather funny, but it's not complete. This is a practicing model for physicians to train delivery. Now the baby is not there because it was used so much, this practicing model, that the baby doll,
Yes.
also of leather, that was damaged, and we have it it's now in restoration.
I see many such models at my university. They were all plastic, of course, but the basic idea, female anatomy hasn't changed in the last 300 years, so the idea is always the same. Because when we talk about the process of delivery, you have a lot of measures. There's a lot of things that you can see in practice, the rotations and...
So we have much more of over there, more obstetric instruments, also all kinds of forceps and so on. And well, this is also what you see there is it looks like a bit like a syringe, but it actually is an irrigator. We know it as a baptizing syringe, but it's actually an irrigator. And I found in French literature, the French were very fond of irrigators and irrigation, that you could use it as antiseptic against infections, as anticonceptive, although not very reliable. Of course, then you probably were supposed to rinse the sperma from the vagina, but here we knew it as the French call that salvation. Then when with this syringe you could baptize the unborn child with holy water, and that they did that when the child was already dead or would probably not survive the delivery, and then in order to be able to bury it near the church, it had to be baptized. Otherwise, it was not allowed to bury it in holy ground. That was in the Roman Catholic Church.
A very exquisite concern for us nowadays. It sounds weird to make an instrument for that, but it's part of history. It's interesting.
But it was originally an irrigator, and wrote in French. It was antiseptic, anticonceptive, and salvatrice. They call it.
Forceps used to be used much more before we had C-section. I once did a presentation on the history of partum, the history of delivery on my university. And back then I still have the recording, but it's a very bad recording, so it's not worth watching.
Yeah, well, it's just maybe I wonder whether that kind of shoe spoon there, that's what we call it Ron, the secret of Ronhuizen. He was a physician who was very famous. He was very good at delivery, and well, in those days everybody had long clothes, so he used that very simple instrument. He was called Ronhuizen, and therefore he was well off because everybody came, well, you should have Ronhuizen for the delivery because he is so good at that. And was much later, it was known to the public that it was actually such a simple device. Yeah, that's here. The development of pacemakers, that was here.
Yes, this is more recent.
1969, it starts and it works a year and a half, and then they get smaller and smaller and work longer and longer. Yeah, this is all for surgery instruments. Well, the what we call the rough work.
That's for orthopedics.
Oh yeah, well, this is also that is a bladder stone and more bladder stones, and here in how they got out these bladder stones, because when you have such a big bladder stone, well,
it's surgical, yeah.
But they did that already also in the 17th century, but you had no anesthesia, so therefore you needed a couple of strong men who held the patient, and the man who did the work, he should do it very quickly. Yeah, when you were good at it, and he did that very quickly, then you had a chance to survive it. But well, with the bladder stone, you didn't survive either, so you really had no choice. But here you have the old masks for anesthesia.
Yes, I wanted originally to be a surgeon. Eventually I settled for influencer, a less than common medical specialty. I have to admit that even though I originally wanted to be a surgeon, it's hard to deny that the most important development in surgery was anesthesia.
Absolutely.
Because there's some kind of a rivalry between surgeons and anesthesists. Anesthesists. I'm not sure how to pronounce it.
Yeah,
Anesthesists. Yeah. The great question there is that anesthesists usually are the ones that cancel the surgery. That say, for example, this patient does not have surgical conditions. He cannot be performed surgery upon. So for that reason, there is some kind of a rivalry between surgeons and those in anesthesiology. But even as nowadays, as I said, I am still a medical doctor. I did not lose my license, but I consider more of myself as a teacher, an influencer. But as someone that originally intended to go into surgery, I have to admit it would be almost impossible to perform any meaningful surgery without anesthesiology.
That's quite right. Although surgery was done, you see it before, but well, then you couldn't do much other than make the people drunk and some morphine or opium that they have also. But the microscopes, there are quite a collection of these also. Yeah, these are all replicas, or the three of them. But on the picture,
It's so small.
yeah, it was, and it seems that he has made about 500 or so, but they weren't it was not very easy to handle them, because you had to put the sample, well, on that little pin on the rear side, and then you had to look through that very small, you see that a small hole, there's the lens is in that, and because it's such a good lens, you can use that. But it was not very easy, you had to have good light. So the one in the Boerhaven Museum, as far as I know, is found in a Delft canal. So somebody has thought, well, it doesn't like it, throw it out. That's what we think, but it wasn't not very...
Someone was riding a bike and dropped it. I remember when I was studying histology at university, you originally had single eye microscopes. And during our course of histology, we got a new batch of microscope, and those had both eyes. And it was so much better and so much more comfortable.
Yeah, you said inderdaad, it was very tiring in one eye microscope.
I imagine it must have been a pain to work with these, trying to see the very small.
Yeah, and yeah, they were really this kind of measure, but well, I'm not sure whether they have it in the I think in the normal exposition, the Van Leeuwenhoek microscope should be there, and these are all, yeah. Mr. Griffioen, the founder, he was very fond of microscopes, so therefore we have quite a big collection. The story he told, that then he went to Christie's in London to buy microscopes, and then he went with the night boat from Hoek of Holland to Harwich and then to London. That's about 6 hours at sea, and then he came back in the morning, and so nobody asked for what he had with him. He never had problems with the customs, he told, but they are very old ones, and yeah, all different models, and also the more modern ones.
Yes, it's quite a collection. Many microscopes. And most of them more than 100 years old, some more than 150 years old.
And even older, the Culpeper type, these are so very simple. So these are from the 18th century. Yeah, then at that time microscopes were more like playthings. That you could the preparations, the slides, you bought them with the microscope, and then you could see all funny things or insects and so on. So it was more like entertainment, working through the microscope and see what insects or starch globules.
Yes, what child did not have a microscope that came with some ants or leaves?
Pollen from plants, and what was said, starch powder, which also has look quite different when you have potato starch or mice, corn starch. That all looks different under the microscope. So, well, in those days, I think it also was the end of the 18th and 19th century. People were discovering what was all going on in nature, and they're discovering plants and so on. So well, then they wanted to look closer at it. Yeah, the dentistry department is, you can't see that very well. There are many objects, but that's. Here are the very old-fashioned
I have no idea. Oh, okay, this is for some. This is for.
but
Not the word's not excavation.
yes.
For drilling into teeth. It's a drill. It's a drill.
But many people, when they see that, say, oh no, that.
And it's moved by the. Does it still work?
As far as I know, it will, but you.
Yes. I mean, I'm not going to do it really fast because it's old and delicate, but it still turns. It still turns.
Yeah, this is a wax models, but well, you have your YouTube for educational purposes. More than 100 years ago, they had these wax models. They they all made in Dresden, in Germany. And it seems that you had the kind of factory have colored pictures, so you had these beautiful drawings. But for skin diseases, this was more like reality. So that's they were for students in universities, I suppose. They had a collection of. Such wax models.
Yes, these are not as common anymore because nowadays you can just look on the internet, for example, what the condition looks like. But for example, even to this day, I'm not sure really here in the Netherlands, but in Brazil, if you go, for example, to a cardiologist's office, it's quite likely we'll have a model of a heart, for example. To this very day, just some degree of these replicas are still used. Here's the thyroid.
That's walk through to the other room at first. That is our medical cabinet or medicine chest with all kind of samples.
Which is more of your area. You are in a pharmacy. My mother is a pharmacist as well.
Oh, I see. But we have rather a very big collection of all these Simplicia, as we call them.
Do people still, how can I explain it? Manufacture drugs artisanally here in the Netherlands? Let me explain exactly what I mean. My parents have a pharmacy in Brazil, which we would call a manipulation pharmacy. What that actually means is that she buys the raw components and then she does the preparations according to what the doctor has requested. Because nowadays what's most common is that you just go to the drugstore and say, hey, I need like ibuprofen, and they will hand you a tablet. But sometimes you take the prescription from the doctor there and they say, okay, come in 2 days and we'll make it for you.
That is when I started working in, which I told you is more than 50 years ago. There was still, I think, about 5 to 10% of the medicines were made in the pharmacy itself, either on prescription, but also on a on a larger scale, because we had, I remember we had a physician who had a special cough mixture, and in winter then you better make 5 or 10 liters of that. That was easier than every time that happened, because you knew Dr. He always wanted that mixture. But nowadays it's in most pharmacies they do not prepare themselves. Well, in hospitals it's still done, and also in some what they call preparation pharmacies. But of course, sometimes for children or for experimental drugs, that's in the hospital. So it is still done, but here in the Netherlands it has gone down in these past 50 years. Because it first they try to make the quality better, but then then if you will make the quality better, it's rather expensive, and then there came small factories who made all kinds of that preparations on a larger scale. So then it was not a real patented drug, but all kinds of ointments and so on that were then made by firms on a larger scale, so that was cheaper. And so the insurance companies all said, well, I'll pay back the cost of that on larger scale prepared ointment, and well, you get on the same, and then it's on a small scale. That wouldn't do it. You wouldn't get enough money for this time-consuming work that you have to do. So, therefore, home preparation is only for special cases, for doses for a child where there is no tablet in the right dose.
3 milligrams of, I don't know, prednisone, for example. 3 milligrams of prednisone.
That's because there are by these smaller companies who make these ointments, and sometimes also tablets in different doses. So there is then not so often there is the need to make it yourself. But I can imagine that maybe in Brazil it's many things have to be imported, and perhaps that's more expensive. Then it could be that it's better to make it yourself. That's more economical. But
yes, in Brazil, from what you told, I understand that probably here in the Netherlands, the insurance companies pay for all the medications. In Brazil, what's most common is that we have public health, but it kind of works. Let's put it like that mildly. So people that can have insurance, but insurance is usually for hospitalization. So if you get to the hospital, your insurance pays.
For the large amounts.
If you have to buy, let's say, an antibiotic, if you have to buy an analgesic, an anti-inflammatory, for example, you usually pay out of your own pocket. So you just choose the pharmacy you prefer.
For the most simple things, vitamins like acetaminophen or paracetamol, and simple analgesics, these are not paid for. You have to pay that yourself. But most medicines are paid. But then when there is the generic preparation, so first you have the patented one, but then when the patent is over, you get what they call the generic.
Yes, we have that as well.
Generics, and then the insurance only pays for the generic, and that's the trouble. In many cases, they only pay one brand of the generic, and that they make deals so that that's the cheapest. And but then often you get that then everybody wants that brand, and then they can't produce enough. And we have here in the Netherlands the last few years, and it's getting worse and worse, that some drugs are simply not available. The pharmacy can't buy them, and well, we think that is partly because the insurance only pays for one special brand, and then the other companies, they think, well, we are not going to produce that anymore for that. For the rather small market, the Netherlands is not a big country, and so you have to have the package and the information all in Dutch, and they have that. So they think it's not worthwhile for such a small market.
Do you still work as a pharmacist?
No, I have worked in pharmacy, but I'm retired since yes, 13 years. Well, after my retirement in my own former pharmacy, I in holidays and so on, I helped them. But then at some moment they moved to another building, and then I said, no. Then I was 74, so I said, well, it's okay now. I've done enough. And but well, then the volunteer job in the museum, that's still near my profession, of course. So. Well, this is what I wanted to show you, that these medical cabinets, they were originally a compilation of samples of single ingredients that were made when you prepared the medicines yourself. But here, this one is a very large compilation. And it is very systematically arranged. You should see it as a kind of catalogue of a wholesale company in the 18th century in Amsterdam. And here is the seeds department, always with Latin. Well, no, it's not all Latin. Here, this is Dutch. It says Dutch watermelon seeds.
Are there still things inside them?
Yeah.
Yes, there are.
Not in all of them, but most of them. And there are, so the date is from 1722, 1716. It's this is the merchant, the company, they were very proud that they could offer such a wide variety of herbs and spices and all things of nature, because cinchona bark of Southern America. Well, I'm a pharmacist, but I didn't know there were so many types of cinchona bark, very rough ones and thin ones, and they differ in the amount of cinchona alkaloids in the bark. But it's not only plants what is in it. There were also minerals like kaolin and zinc oxide and copper chemicals. And this is also funny. This is more like that people want to be told stories. These are balls, gastric balls, but that fall from a special exotic Indian type of goat, and they were very rare and of course very expensive. sometimes they were gilded and put above the bed. That should work. But you could also pulverize them, and that worked against all kinds of diseases. And now you can imagine when something is expensive and rare, people try to make money and they falsify. They think, well, when I make such a ball, and these falsifications were made of gums, Arabic gum, and inside there are also warnings that they say, well, if you want to know if it's a real one, then you cut it through the middle, and when it's a real one, then you see you can see that it's plant material, because these goats, they eat plants and grass and so on, and then so you can see the texture of the plants. Whereas when it is gum, it's false, it's quite eagle, you don't see any structure of plants. Well, we don't dare to cut them, but well, we think that because these are probably false, but well, it didn't really work. But when something rare and exotic, that's of course with the magic. That's the magic there. But
this cabinet is from the 18th century, is that it?
yeah.
But
The chest itself is probably not that old, and it's also not what we have.
so it's like the collection is from the 18th century, and the wooden work itself
is from later. But it is also in 1912 a student has made a catalogue of from all the numbered drawers and what is in the drawers. So dit is the drawer is the Syngona, Cortex Kine, we call that then. Hij zet er hierbij, these Simplicia 10, they all the names are probable, so he's not quite sure of them.
The calligraphy is impeccable. It looks printed.
Yeah, that's we are very proud of. This is from 1912, and a pharmacy student has made it. But it's if we didn't have this, we ourselves we didn't recognize that in English. And whereas originally, when you look at these things, you had to. When I studied pharmacy around 60 years ago, then you had to practice. Then you had to know the appearance and smell of about 100 of these Simplicia, but that were the more simple ingredients like nutmeg and cloves and cinnamon. So that's not so difficult. But then there to practice you had then these tubes with just a number on it, and you had a list that which number was what kind of herb, and then you had to practice so that when they showed it, then you could say, well, that is nutmeg, or it is the lion, or whatever. So these. This is a very big one, but in the Rijksmuseum they have a very, very beautiful chest because they were the collections were in the hospitals also for practicing, and that you know your ingredients. But in rich families they also had it, to show off that they had. All kinds of exotic things, and they could buy that to show off their wealth.
You studied pharmacy here in the Netherlands?
Yeah, in Leiden.
Leiden. It's where Borghave Museum is.
Yeah.
I believe there is a famous medical university there as well.
Yeah, there was Boerhaave.
I've heard of it.
That's what the museum is called, Boerhaave. And Boerhaave was, of course, a medical professor, but he was also very good. He knew very much about plants, and that it's still next to the university is the botanical garden, and Boerhaave was also the head of the botanical garden, but he was also very interested in botany. Of course, he used the herbs to as medicines, but not only that. He studied botany also, and it's still a famous botanical garden in Leiden. But well, you can't see everything, of course. But it's behind the university building, and it's not really quite near the Boerhaave Museum. That's in a different part of the city, because Leiden is also a historic city, bigger than Delft, I think. I hope you have enough material.
Thank you, absolutely. Which was really nice seeing it all. I want to thank you again for opening this exception to me, to come here especially to open the museum for me.
Well, it's, you can understand, I don't do this not in, well, I used to do it much more, because I can only do it when it happens to be on the day, or I can arrange that. But I've always had much pleasure in doing this. So,
it was quite nice seeing it all myself, seeing it. And yes, I hope we will transform this into a video for the public.
That you have so a lot of, well, I think that's your expertise, that you know how to make a good video of that. Oh,
really?
Yeah.
Okay, so this is for Instagram, for example. We are here at the Medisch Pharmaceutisches Museum of Delft. Is that Delft?
That's right. Yeah.
Do you have any final message to end here and to share your museum on Instagram, for example, or something like that?
You are all welcome to come here and explore the history of the medical profession and of pharmacy, and you will see that many things that were done in history are quite alike to what we still do now to help the patients.
Thank you. Susie was very kind to open the museum here for me today, and I hope to make it available on a movie on YouTube very soon. So this should all turn into a more traditional video. Thank you again.
Of the board, I'm the treasurer, but we also have the president and the secretary, and so on. But we'll see. So you know the way to the railway station?
Actually, I don't.
It doesn't rain anymore.
It rains a lot in the Netherlands, doesn't it?
It rains a lot, yes.
It's one of
although we have had, not this year, but the years before, very hot. And then you see that pole with the signs, and then at the end of that shorter canal you go to the left, and then you get to the railway station.
Okay, thank you.
Have a good
It was my
trip,
pleasure.
and have a good journey back.
Good luck to your museum,
Yeah,
and
thank
good luck on your life. Have a nice day. Goodbye, Susie. Here I am in the quaint Dutch city of Delft, just out of the museum. This is literally the most convoluted setup I've ever had, between the suit, the overcoat, the mic, the gimbal, and the cell phone. I literally take like 15 minutes to get everything on. So now on to attempt to get to the train station. Some light rain, and this is one of those older traditional Dutch cities, more unlike Rotterdam, and we'll get further into that in a bit. With some worries not to get run over by any car or anything like that. Does every Dutch city have some canals? Possibly. I also need to buy an umbrella somewhere. There is a lot here. And actually it is slightly warmer than I expected it to be. It was meant to be like 7, I think now 7 Celsius degree. I was expecting more like close to 0. So I earlier tried to get a lavalier wireless mic, unlike the one I'm using right now, which is wired, because it messes a bit with the work of the gimbal. So, what did the image and the sound of yesterday have in common? Yeah, they're both short of our expectations. So, things get a bit harder. So, the gimbal is essentially a stabilizer, which ensures that the phone does not wiggle so much as I walk. So, it looks more, it's like a super selfie stick. It is essentially a selfie stick, but it compensates for any movement I make to make it all smoother. I think I'm gonna get an umbrella.